So the quest for the safest and most efficacious BCL2 inhibitor in myeloma continues. We presented data at SOHO on a novel BCL2 inhibitor called Lisaftoclax in different combinations in patients with myeloma and AL amyloidosis. We had two cohorts of patients with myeloma. One of the cohorts was in combination with pomalidomide and dexamethasone. The other one with daratumumab, lenalidomide, and dexamethasone. And the AL amyloidosis cohort was in combination with pomalidomide and dexamethasone. We enrolled patients at first relapse or beyond in the myeloma cohorts, and the AL amyloidosis cohort either at first relapse or they had inadequate response to their initial therapy. So the data that we presented were on 52 patients. The biggest cohort was arm A, which is patients with myeloma in combination with pomalidomide and dexamethasone. So the drug was found to be well tolerated. Most of the adverse events were hematologic, of low grade. We did not really see major serious adverse events, speaking to the safety of this drug. It was also well tolerated in patients with AL amyloidosis, which is a different cohort of patients that's more delicate. But the drug really had low toxicity in that cohort. In terms of efficacy, the data that we had for efficacy were mostly for arm A, which is in patients with myeloma with pomalidomide and dexamethasone. We had 36 patients that we evaluated for efficacy in that cohort, and the overall response rate was close to 64%. And there was a wide range of prior lines of therapy in this cohort, ranging from 1 to even up to 29 prior lines of therapy. And notably for this trial, all comers were enrolled, which is different from other BCL2 inhibitor studies where only patients with T1114 were enrolled. And we only had 4 patients with T1114 on the study, and the majority of the patients were actually non-T1114, which is different from other BCL2 inhibitor studies. So the response rate was 64%, and the median progression-free survival was close to 10 months. So this is pretty promising for a BCL2 inhibitor, and we are hoping to continue enrolling on these cohorts, including dose expansion cohorts.